afternoon, viewers, and welcome to Health 360. I'm your host, Alicia Martin. This week, we will be talking about Rehab Week 2020. The theme this year is Improving Lives One Day at a Time. Joining me today are a few persons from the Disability and Rehabilitation Services attached to the Ministry of Public Health. I will now allow them to introduce themselves to you. Kenan?
Right, good afternoon, everyone. My name is Keenan Benjamin. I'm a physiotherapist attached to the Palms Rehabilitation Department, but I'm currently working at the Georgetown Public Hospital on loan, you can say, basically.
Hi, my name is Calvin Laurie. I'm an occupational therapist at Palms Rehabilitation as well, and I'm currently at the GPHC.
Hi, my name is Sonia Fredericks, and I am a speech and language therapist. And I am currently attached to the speech and language therapy department at the Georgetown Public Hospital, also taking part in some sessions also at the Tolerate Center on Carmichael Street there. And also we have with us is Anissa Ambrose. This is one of our patients which attends physical therapy department at the West Amawara Regional Hospital, also known as the Best Hospital. She's also here with us in studio.
Welcome, guys. Thanks for joining me today on the program. So before we get into all the activities and so forth and those good things that you guys have going on down there at the rehabilitation services, Mr. Benjamin, could you tell us a little bit about the department and what you guys do?
Well, our program is the Disability and Rehabilitation Services Program, and it comes directly under the Ministry of Public Health. Our director is Dr. Aryan Mangar, and I'm proud to say one of our newest programs that is under Disability and Rehabilitation Services is optometry. So Disability and Rehabilitation Services now encompasses optometry, physical therapy, occupational therapy, speech and language therapy. We also have the vocational training schools at Open Doors, and we have our homes that we also have. There's also the training schools at the Ptolemy Reid Rehab Center, and they are the homes that are at Cheshire Home at Mahika, and there's also a daycare facility at the Ptolemy Reid Rehab Center.
Thank you,
There's
Kenan.
also audiology coming under Disability and Rehab Services.
Okay, for those persons who are watching the program and are wondering what is Rehab Week about, could you tell us a little bit about that and what are some of the activities that persons can look forward to?
Well, Rehab Week is basically a week of activities that are geared to celebrate the profession of rehabilitation. As you can know, as many people might not know, it's a profession that has been around for quite some time. This year is actually going to make 71 years since rehabilitation services started in Guyana. So Rehab Week serves to highlight rehabilitation in Guyana and to promote our services and to make the public aware of what is happening. It also is a week for us to celebrate the work we have done throughout the year, and also to meet and to socialize with our colleagues from the various regions, because we are in all 10 regions of Ghana. So usually everyone gets to come together at this time of the year because we have summits and there's some social activities, there are cocktails, award ceremonies, and these, it's just a week to celebrate rehabilitation in Ghana. But as you know, due to the pandemic, things have changed this year. So we are not meeting physically, but we're still meeting in the technological space per se.
Thank you, Keenan. Mr. Larry, I know you guys would have introduced the telemedicine or the telerehabilitation service. Could you tell us about that and what it is and how is it done?
Well, tele-rehab is the use of technology to treat patients. So using all social media, whether it be WhatsApp, whether it be just a normal phone call or a video call, or even a Zoom meeting. So that's how we treat patients, and we tell them what to do, walk them through their exercises. If we're on the phone with them, walk them through their exercises. We would also send videos or video call them and show them what to do. But for occupational therapy, it's actually very easy, or it's a plus to use telemedicine because we help persons to go back to their activities of daily living. So, being and maneuvering around the house, using things at home. So, we show them how to use things in the kitchen. So, we'd have a family member there and walk them through the steps as well. So, they would be able to make sure that their family member is safe and things like that.
Okay, how often is this done? Is it done twice per week or once per week? How is it done?
Um, it all depends, but most times it's like once a week. You'd contact your patient. It and it may vary. It all depends on how severe their impairments are.
Okay,
So
and what?
they're encouraged to keep on doing their exercises during the week. So it's not like when I call or any one of my colleagues call, that's the only time they're doing their exercises.
Okay, great. So, how are patients responding thus far? I know persons are accustomed to going to visit the hospital or the center to get the treatment and to access these services. But since they're home and practicing social distancing, I know it's something that persons are not accustomed to doing the exercises at home and so forth. But how have they been responding thus far?
At first, it was a little bit tricky and difficult because we as professionals, we were now trying to feel our way around this whole approach with telemedicine. And me working with the older population, they're not that technologically advanced and they're not into the tech as much. So a lot of times their family members would have to assist them with that. So it takes a little bit of adjusting, and then a week or two, give or take, they would have adjusted to it.
Okay, what are some of those exercises that persons would do at home? What are some of those tasks and activities?
Well, for occupational therapy, it's basically teaching them how to do their basic activities at home. So whether it be brushing their teeth or combing their hair. So I would show them, okay, let's try to comb our hair. Hold the brush like in a certain way, or hold your toothbrush and walk them through the steps.
Great. Ms. Fredericks, could you tell us a bit about some of those challenges of telemedicine and how persons would have responded to those challenges?
Okay, so speech therapy has gotten the most challenges thus far, basically because our most of our clients are children, and already to have a child in the therapy department just to sit and complete an activity already sometimes is a challenge. So just imagine that child now in their own environment and you wanting them to sit in front of a computer or in front of the phone to do an activity with a parent's guidance. We have found that it's very, very challenging. And we have found that the parents are just praying and hoping that COVID-19 would just disappear so that they can continue with their children at the therapy department. We haven't been having much success with the telemedicine, and the parents are really trying, but it is challenging because, COVID-19 just splashed on us. It just came out of nowhere. And these parents were accustomed to bringing their children to the therapy department, letting us do the therapy. They do their little thing at home, but it was mainly dependent on us. So it's a very big challenge. And other than that, we have a lot of our parents or clients, they do not have the access to the internet. And due to this, we are not able to, even if it would work for them, it it wasn't there to try. So we have that challenge here in Guyana. And even so, if some persons do have internet, we know the internet, the signals are not always that great. So that's another challenge. So we have relied a lot on just calling our patients and just, checking up on them, just seeing how best, if it's a whole hour we have to spend on the phone, just seeing as much advice as we can give them. In the field of occupational therapy and physiotherapy, they have, when we meet together, they tell us it's great, it's going great for them, their patients are doing well, and so on. So, but speech therapy is having its challenge. So our patients is just waiting to get back out into the clinics. So that's what's going on with us. The biggest challenge, and this is just to show guys that we really need to get on that technological line,
Yeah.
of access to internet and understanding how to use it and so on. So we really have a way to go.
Definitely. What are some tips for parents at home right now who are helping their child or their children in regards to telemedicine? What are your advice to parents right now? Some things that they can do to ensure that this period, while they do telemedicine, it is successful in spite of the pandemic and all that's happening.
Yes. Well, the first thing they have to make it routine. They cannot want today we're going to do it, tomorrow we're not going to do it. You have to make it routine. Sometimes we like to tell them, the reason why school is 5 days a week is so that the children can get into a routine. And therapy basically follow that same procedure. So you need to make it a routine. If every day at 9 o'clock, this is what you're going to be doing, this is what we're going to be doing every day at 9 o'clock. Not let anything get into your way at that time, clear that time when it's that time to do therapy with a child. So if the therapist do call, we're ready and it's 9 o'clock, all the materials are there, the child is ready and so on. So that's the key thing when it comes to children. You have to make it routine because even at the clinics, this is how we've tried to make it routine. If we give that child every Wednesday, we try to make it keep every Wednesday at 9 o'clock is that child. And we ask the same thing during this time of trying to work with the telemedicine. So that's basically what we tell parents. A lot of them, they have been in the sessions at the clinics, so they know a lot of what we do. I mean, at this time, maybe they did not have all the things that we use in our clinic, but we can talk about it and improvise with what they have and make it useful and make therapy. As for us, if you do come to our therapy department, it's all about play. It's a child and you got to make it fun, really really fun. So that's how we're just trying to help them and guide them at this time.
Thank you, Ms. Fredericks. Ms. Ashley Singh, I know you're one of the patients at the West Demerara Hospital and you have been accessing the telemedicine services. Tell us how beneficial this service has been to you.
Well, good morning once again. I'm a patient attached to the West Demerara Regional Hospital, and the rehabilitation service has benefited me a lot, and it's really, really, I feel comfortable like taking therapy there, and it's very convenient there, and it's really like for affect during this pandemic now. It really affected me because I can't get to go. I can't get to do my exercises as I expected to do. But I can't get to do it how they do it for me at my therapist work with me. I really can't do it the way how she because it's just me alone and I really can't depend on nobody. So the rehabilitation is really assisting me and really helping me out a lot.
Okay, Ashley, what would be your advice to persons who are also accessing the telemedicine service and are having challenges at this time? What would be your advice to them?
Well, my advice would be like who attached to the tele if they could if they are available get in contact with their physiotherapist or so let the therapist give advice to do at home and teach them what to do at home and you could able to work along through the internet or on social media, how they connected, they could able work along with them and show them what to do, how to do it, and they could get along with the daily activity like the exercises, what they have to do, or the different types of exercise, what to do. So they could get along with it.
Okay, thank you, Miss Abrams. Mr. Benjamin, just before we wrap up the program, could you tell us about the importance of um, mental health wellness during this time of the pandemic? I know you guys are dealing with patients and all that. So give us a little insight on that.
Um, it's a very important topic, and it would probably take an entire program to discuss it. But to share with you, yeah, it's normal to feel anxious during these times. I'm sure a lot of persons would have experienced some forms of anxiety during as especially leading up to when the pandemic first broke out. You know, because due to lack of information or maybe a overload of information because so many things were being said on social media. Some people might have went into panic mode, and you know we saw panic shopping and all of these things happening. So it is important to edify yourself or to educate yourself about what is happening or what is currently happening. So gaining that knowledge about the current situation is very, very important. Even as the pandemic is still going on, it's important to keep yourself up to date with the current info that is out there and the current stats, while at the same time not overloading yourself or saturating yourself with too much information to go into that panic. So some of the sources of the anxiety for the person, especially persons that might have worked during this pandemic, like myself, I know one of the things we were worried about first and foremost was like how many cases Guyana really have. Are the numbers really true? How contagious is this thing? You know, if I touch this doorknob or if you know somebody sneezed on me, you know, we were wondering how about how this virus can be contracted. I know one of the things that I was first and foremost on my mind also was the protective equipment, the personal protective equipment, the PPE. You know, do we have adequate in Guyana? Because when you looked around the world, you saw that even in these developed countries that, you know, the big US of A, they people wearing plastic bags and going to treat patients with COVID. So these are some of the things that would have caused anxiety or would have caused some stress for our local our local workforce. So one of the things we need to understand that it's normal to feel stressed during these times. It's normal to get anxious. But when you get these feelings, you have to take ownership of them and, you know, take a step back and breathe and assess everything that is happening around you, you know? And, you know, it's normal to want to take a break, you know? It's normal to want to take a break. It's normal to, and we need to understand and need to remember that exercise is still very much important during these times. We are not allowed to go outdoors. We are not probably not allowed to go take our regular walks and runs in the park. But exercising at home could have happened, you know, or you could have still exercised at home. And we just want people to remember that if you were feeling stressed or, you know, you were anxious about what was happening or what is still happening during this time, that exercise is key. Like exercise is essential to helping you get through this difficult period.
Definitely. Thank you so much, Keen and Benjamin. I want to thank you all for joining me on the program today to share with the public. I do encourage you guys, keep up the good work that you are doing down there at the Disability and Rehabilitation Services Ministry of Public Health. This is where we say goodbye for now. Thank you for joining us today. Thank you for staying tuned. Do stay safe, Diana. Goodbye for now.